You're listening to Stellar Success, Leveling Up for Medical Pros with Dr. Tudor Francu. Join us as we explore how medical professionals can achieve stellar success in all areas of life. It's time to level up.
Back at Stellar Success Podcast. Dr. Kapur, thanks for coming over.
Thank you for having me.
How are you?
Doing great. It's been a busy day.
So tell us a little bit about yourself. What was your beginning? What was your journey?
Okay.
And what are you doing now?
Great. So professionally, my journey started actually quite young. I had exposure to lots of different types of small jobs as a teenager and landed in a nursing home. And it's interesting because after that time, my mother worked in nursing homes. I became a geriatrician who worked in nursing homes and admitted the patients as a physician. And I also then got extra training in palliative care and hospice, end of life. So I'm boarded in internal medicine, geriatrics, hospice, and palliative care. And then a couple of years ago, I got an MBA because I wanted to connect business and clinical.
Connect business and clinical.
Yes.
This is a different subject that
Yes.
I want to kind of dive in a little bit. How do you feel that after so many years of practicing clinical medicine, you decided to go into a business aspect of it?
I feel it was a natural evolution for me because I think in order to help in these leadership roles, I was a medical director at a couple of hospices. I was also a chief medical officer of a large hospice company, and now I'm a chief development officer at another healthcare company called Chestnut Health. Basically, that transition evolved, and I felt it was needed. I think that's the biggest thing. I like it. It's perfect for me.
Nice. So this MBA, do you think, does it worth something for you in general, for people that want to go in that route?
I don't think you need an MBA to be successful. I work with so many professionals who have mentored me and did not pursue it, who are very successful because they learned along the way what you learn in MBA school. However, for me, it was an organized way with like no business experience to kind of get the basics like accounting, finance, economics, to kind of really then apply it to what you're doing in your job. So it was helpful for me.
Interesting. So what are you doing now exactly? What's your focus?
So my focus right now is I work at a medical company called Chestnut Health under the CEO, Omer Siraj, who is actually a great mentor of mine for many years, and just happened to have an opportunity as I moved along in my career to join his company. And it was a perfect fit because it's a company that really focuses in on rehab medicine, where I have the pain management experience and the nursing home experience. So you really know how it works. So I'm able to kind of bridge and help develop the programs and also the business there. But I also manage nurse practitioners and assist in the symptom management and also teaching. So I gave a lecture today at a huge hospital here in the Chicagoland on medical marijuana. So my training has really exposed me to a lot of different awesome topics that are, and complex situations that I can help and dive in.
Yeah, it's a big topic, and obviously a lot more physicians need to know more about the subject, because I can only, if I think back a few years back when this whole like approval legislative initiative started.
Yes.
To approve the use of marijuana for medical use and recreational, a lot of people in medical world were kind of caught by surprise. And
Yes.
there's so many aspects and implications in the general health of the population that need to be
Yes.
considered.
100%.
And I remember in my field in anesthesia, it was like a shock, because people had no idea what they're dealing with. When people, they came for surgery, they had to get anesthesia, and all of a sudden this whole thing is upside down.
Right. That's great.
And
You're
I
an
think more,
anesthesiologist.
yeah, and I think more education need to be done in this field. And doing this by yourself, it's obviously a good thing for all kinds of physicians.
Yes.
What do you think it's from your point of view, from what you've seen so far, what do you think is the most difficult challenge in healthcare presently?
I think the difficult challenge is ensuring the high quality of care as we propel ourselves into everything has become a business, right? And so when it becomes a business, you're looking at your margin. And when you're looking at your margin, something has to give. So it's really keeping that quality of care up. And that has been the focus of my entire career, whether it's at my job with Chestnut, whether it's my part-time work as a med spa medical director, whether it's my work working at a med device board and giving my recommendations on how do you do this right, do it right from the beginning. It's all about quality and bringing that wellness to the system or to the people in every avenue.
You said margin. I start laughing about that because I'm trying to wrap my head around if there is any other margin that we're having other than the insurance companies out there. And I don't know, in your experience with all these private enterprises you're in, what do you encounter in terms of margins and profit? Because I think the insurance model is swallowing up everything in its path.
I'm not as involved in the day-to-day with that in this role that I am right now. I'm in the field. I'm kind of more doing business development, clinical programs with seriously ill patients. But I will say at my last job as a chief medical officer for 3 years at a large hospice and palliative care company, the margins vary. You want to make sure hospice patients are taken care of well. But there's that side where you also have to make sure that the people that are taking care of the patients can feed their children, right? So it's you have to have the right ratios of staff to patients. And you have to make sure that the workload is also appropriate. So it's striking that efficient balance and ensuring that payments are coming in on time and then, disseminating. There's so many costs, right? Keeping the overhead low is not easy. So I think it's a matter of having more volume makes things a little bit easier in any business.
Yeah. If you look back and, until you achieved this much success so far, I'm sure there were some moments where you said things are not going well. I have some setbacks. I had some failures. What am I doing now? Can you give us an example of those things?
I would say I never thought of myself as, okay, I've never been so hard on myself. I just was raised with a family that really, taught me self-compassion, right? Which is, thank God, right? But at the same time, there have been times where I've been kind of stuck, like in residency to get to the next point. I had a child during residency at the end, and that was very difficult because you have so many exams, you have so much responsibility, and then you have these people that just don't, they don't understand that, right? And so you have to just do your best, I think, in those moments. And I would say in different areas, later in my career, the challenges became less acute to me because I have more perspective in life. So I always knew things were going to be okay because they were always okay back there. So they'll be okay now. I have so many skills, so I'll use one of them.
Yeah. Interesting. So, good. What are you focusing on now? What's the good thing that's happening? What are you looking forward to? What do you think the next project is going to bring you?
So I am looking forward to doing a very good job in everything that I do, as I always have tried. My focus and shift has been a little bit more to balance and having more time with my adolescent age children. I have 3 girls, and I'm able to give them that time because of the great environment and culture at my job with Chestnut. And because of that, I've been able to give attention not only to myself, to the family, and also to maybe some other smaller projects that I might want to do in the evening, right? Or real estate, whatnot. My whole life is not consumed by 24/7 call coverage. And I've been not doing hospice for 2 years, but I'm actually very good at it. I get excited if a family friend calls me and asks me what to do or how to manage this pain. I've done it for so many years on the spot. I know what to do. I know all the intricacies. I'm boarded in it. But taking a step away is okay because I will then go back to it when I have the bandwidth. So I've been honoring myself a little bit more, and I'm more selective about where I choose to give my energy.
Very interesting. You mentioned real estate.
Uh-oh.
And I'm thinking, that a lot of people in the medical field, they get to a point that they love their job, they want to practice, but they can't, and they can't retire because of different reasons. And they don't have this second income that can sustain them through retirement. What do you think about that and relating to what you said about real estate? Can you tell us more about what you're doing?
It depends on your interests, right? So I think I I like exploring the business side. So for me, short-term rental, sprucing up an Airbnb, and making a little bit of passive income on the side is the way that I kind of look at it. But I think every physician, every person should look into all the investment opportunities that they have and what they have capital for, and start at a level where you can handle it, and then continue to get a little bit more involved. Because also there's something called risk. I have a very low risk tolerance. I don't like risk. Why have I not started my own medical practice? There's a risk, right? But there's also a reward in not having your own business. The stress levels are also a little bit better. So it's all looking at what you're all about and what you enjoy. So that's one thing that I do. I consult sometimes with a couple of different companies. I am associated with the Illinois Hospice and Palliative Care Association, and we'll be writing some curriculum for them. So I also, on the boards that I serve to really mentor younger people. So I think for me, it's giving back, right? That brings me satisfaction. Ultimately, when you give, you gain. So, but several different types of passive streams of income is always nice. That is working without you. Your money is working for you. So at a small level.
Well, yeah, at a small level, it could be at a very big level
Yes,
too.
it could. I mean, hopefully we'll get there, but right now it's
Yeah.
definitely not higher than my salary.
Yes, I think it's important for people to look at that, like you said, especially with this podcast, kind of combining the medical field with the investment field and the business side of it. What do you think personally it's bringing you to this level of success? What kind of habits, what kind of routines, what kind of traits you have that you think contribute to this?
I'm a little bossy. No, I'm just kidding. My kids would say so. I'm a leader, right? I'm a leader. And over time, when you reach your 40s, I'm in my 40s, and you get a little more selective, unapologetic, less fearful to tell people what you think, and also to set your life up the way you want to set up your life. If something's not working, the energy or vibe's not right, we back away. If it is working, we move toward the enthusiasm, right? So I am less fearful. As you saw, I took a little risk recently. And I think that's what's helping me set up my life well. I call the shots. I have flexibility. I work with people who value family. I can't speak highly enough about Omer Siraj, my boss and friend, in that he really has mentored me over the years, and almost predicted my life. It's a little scary. What's going to happen next in business? This is what's going to happen. This is what they're going to do, et cetera, et cetera. So when you surround yourself with people like that, you're going to succeed.
Yeah, that's so true. That's so true. But sometimes it's hard to it's very easy to forget, and you get into some kind of environment that you're comfortable with,
Yes.
and you get petted by compliments and by well-being and by people praising you, and that makes your comfort even greater. And when you get so well comforted, you forget that you need to evolve, and you get out of your comfort
Right.
zone
Oh,
and do
yes.
things that are, again, uncomfortable. That's how you progress, right? That's what you did,
Yeah.
what you did
I did, and it was
over and over again.
scary. It's scary when sometimes you don't know after one job, where is the next opportunity that I want? What do I want to do? And I've really evolved with each job into the education, basically based on the education that I got, but also on me as a person. I've been valuing more of what I enjoy. Med spa, hospice, they're not exactly the same. I mean, but I think the idea here is that the root's the same, right? You want people to feel good. You want to take care of people, whether that's from the outside in, and expanding your knowledge base along the way, you're able to do that.
Absolutely.
Lots of tools.
Yeah, absolutely. I want to talk a little bit about leadership with you. It's something that always kind of puzzle me a little bit, because people don't realize that leadership is a combination of obviously born traits,
Sure.
but also very high education and coaching, I would say.
Yes.
What do you think someone in our field should do to become a leader, if they want to take a job like that? If they want to, let's say they're in the they're part of the staff and they want to advance in their place of work to a managerial position or a leadership position, what are some steps that they need to do?
So I will tell you, like you said earlier, it starts in your upbringing, in your traits. I worked basically, my work ethic started very good because my parents were very hardworking people. Father chemist, mother was a nurse, nurse's aide here in the United States. So I saw lots of what they went through. When you have a good work ethic and you watch not only your parents, but then through your jobs, you do the very best that you can. You leave no stone unturned. Then you go to the next level. Then you do the same thing, and you get mentors along the way that kind of can teach you a little bit about what to do to succeed or go to the next level. I think that you have to observe the good and the bad traits to know what works and what doesn't work with people. People skills are very important. Being able to network is very important. Those are skills that I would really encourage people to enhance. I don't think I would have been able to get where I was if I had no people skills, and if I had no ability to network, and if I wasn't genuine and have a good character. I think you have to at base have to make sure that you have a good character and that you demonstrate what you require then from when you are a leader from the people that you're managing. You shouldn't be like a god. You should be somebody that they can partner with to get a job done. You're just the navigator.
Yeah, kind of guide them
Yes.
to their success. Yeah. Uh, with your experience right now and your wisdom, if you would look back to yourself when you started this, what kind of advice would you give to yourself?
When I started my career, I would say don't worry so much. I was kind of I worried a lot about exams. I mean, everybody in the world knows when I have an exam in my house, when my husband has an exam, it's like, oh, I'm in front of the TV, no one knew. So I think that don't worry as much. Things sort themselves out. They really, without your even hand in it, sort themselves out. So I think it's about sitting back and learning how to relax.
Interesting. Yeah, we're so focused when we were young to accomplish a lot,
Yes,
and every little thing is very important. But we don't necessarily have the perspective that we have right now when we're older,
that's
and
true.
it gives you a little bit of a different outlook on life, right?
We needed it. We needed to do it. We needed to, get to that next level in order to have this perspective, I suppose.
Yeah,
But I think that during that process, maybe not having the extra of the worry, knowing that things would be okay and just work. Just work and don't think too hard. Don't look too far ahead. Don't look too far behind. Just stay present and be
yeah,
intentional.
yeah. Very nice, very nice. So, what's next interesting for you coming up this year?
Let's see here. So let's see here. I would say that one company I'm on a board for, Guidance Airway Solutions, we will be going through FDA for our first airway device called First Look. So if you want to go to guidanceairway.com, you can take a look, and that will be hopefully approved by FDA, and then we can kind of get to some sales and also to liquidity. We also have another device that's going to be worked on as well, multi-translating actuating head robot, which is like a Tesla in your colon. And so I'm excited about moving forward with that. That's a board that I'm on. But other than that, I'm excited to see my kids excel. I've been really involved with my kids. They're all really athletic and doing well. And that's leadership too, right? So, if someone were to ask me if I'm bossy, the kids would definitely say so. But the mothers that do that, they have the successful kids.
Well, that's impressive because you're one of those people that accomplished almost everything. You are
Thank you.
a woman in medicine, also in business, doing an MBA, having 3 kids, being successful at home as well as at your work, and looking forward to have new projects coming up this year. So, there's something to say about people accomplishing a lot in a life. And I think an example of this is yourself, which I'm sure it was not easy. It was a lot of preconceptions in the society and the environment you're in, and you
Right.
kind of break through all these things and do the right thing.
I had very good parents. I had very strong parents, lots of, positive energy and pushing you toward your potential. And I find myself now giving my kids lectures like my dad used to give to us. I have great mentors, not only Omer, but Tom Harder Sr. He's a, multimillionaire who he has a private jet. He's the leader of the med spa and this airway company. And my God, the things that he's done, fighter pilot to entrepreneur selling companies for hundreds of millions. I am so lucky to be surrounded by people like this that I'm learning from.
I think that's a very important point.
Yes.
The people you surround yourself with, and even if you're not achieving what they achieved, but just being in their presence,
Yes.
it kind of suits you in their lifestyle and their thinking. It's like, even if you shoot for the moon and you don't reach it, you're still among the stars, right?
You're right. I mean, Tom and Omer are very different in different ways, but you can pick and choose, right? And so me being exposed to all of this, you see what works, what doesn't for you.
Awesome.
Yeah.
Dr. Kapur, thank you so much for being here. I think you're a breath of fresh air in our profession.
Thank you. You are such a sweetheart, and thank you so much for having me and finding me on
Absolutely.
LinkedIn. I love LinkedIn.
I wish you a lot more success. I think probably we'll circle back with you and see where you are in a few months.
That sounds
But
great.
I'm sure you'll be very successful in what you're trying to do.
I appreciate
How can
it.
people reach out to you? Where can they find you to learn more?
I think that you can email me. My email is kuljitkapur98@gmail.com if you'd like to get in touch with me.
Very nice. I appreciate your time.
Thank you so much.
Are you a busy medical professional striving to excel in life and work? Stellar Success Podcast brings you the habits and insights of top leaders in medicine and beyond. Discover strategies for balance, growth, and fulfillment in every episode. Follow us on Instagram at Stellar Success Podcast for daily inspiration. Start your journey to success today. Subscribe to the YouTube channel now.
That's a wrap on Stellar Success, leveling up for medical pros with Dr. Tudor Francu. Interested in joining us? Go to stellarsuccesspodcast.com/guest to apply. Stay stellar and level up.